Sorry, you guys, we're just currently experiencing technical difficulties.
Oh, take three.
Yes, for the money.
Maybe it would be easiest if we just did one by one.
Yeah, probably so.
Do you think people
Let's.
see us?
Rama said let's do one by one.
Let's
Okay,
do one
so we can go by first.
by one. So I feel like, yeah, let's do that.
Yeah, because it's doing too much now. Okay. So hi everyone. My name is Marshawn. My pronouns are he and she, and I'm the community outreach specialist here at Whitman-Walker Health, and I'm joined today with Brandon, and I'll allow him to introduce himself.
Hey everyone, my name is Brendan. My pronouns are he, him, his. I am the social media outreach HIV prevention coordinator at Whitman-Walker, and I'm so excited to be here talking with Marshawn and later two others today.
Right. So as of May 13th, the CDC released a number of new recommendations for fully vaccinated Americans. Some recommendations say that for fully vaccinated people, you can resume activities that you did prior to the pandemic. You can resume activities without wearing a mask, staying 6 feet apart, except for where required by federal, state, local, tribal, or territorial laws, rules, and regulations, including local businesses and workplace guidelines. If you travel in the United States, you do not need to get tested before or after travel or self quarantine. That news caught a lot of people up, and most local and state governments were off guard. For months, we have been wearing masks almost a year, regardless of vaccination status. Now, according to the CDC, masks are becoming less necessary. I will note that the recommendations only apply to 40% of Americans who have been fully vaccinated against COVID-19, and people are only considered fully vaccinated after 2 weeks after their second dose in a two-dose series, such as Pfizer or Moderna, or 2 weeks after a single dose, such as Johnson and Johnson vaccine. Still, the message is very clear. We're starting to return to the normal. And as of today, we're just going to ask my three guests, starting with Brendan, a couple of questions, kind of see what their reactions were when they heard the news. So first, Brendan, I'm sure you're aware of the new recommendations, of course,
Yeah.
in terms of wearing masks, but what were your initial reactions to hearing the new CDC recommendations?
Yeah, I think the recommendations came out on May 13th. So
Mm-hmm.
like almost 2 weeks ago.
Right.
And I remember being with some of my friends who I live with, like I was working from home. And one of them just like, it's like, you need to check the news. And I was like, I hadn't heard that in a while. I was like, oh my God, what happened? Um, and then all of a sudden I like checked the New York Times and it said like the mask guidance. I was super, super surprised just because I feel like we have been emphasizing masking up, even double masking, like even if you're vaccinated. So I was like, I need to read more into this. This is absolutely wild. So I was super, super surprised when I first heard. I think it's awesome now that we're in this place where we can be a little bit more lax about our mask status if you're vaccinated. Like it's amazing that the vaccine gives you such protection and also, is just like giving the community protection against COVID spread. So I was like very happy to see that we were moving in that direction, but it was also like very surprising at first.
Right, absolutely. So you guys, I do apologize for technical difficulties. We're now joined by Rama, and now allow her to introduce herself.
Hi everyone, my name is Ramatulai Keita, and I also work in the community health department here and a lot around the vaccine distribution here in the city at large. So I'm happy to join you guys.
We're happy that you're here, and I'll ask you the same question. I'm sure you're aware of the CDC recommendations in terms of mask. Rama, what were your initial reactions? What were your vibes?
Can I ask you to kind of share a little bit about the recommendation with my platform that just joined, since I just joined the space? A little bit of what you said earlier. about what
So
happens?
So earlier, I just recommended for fully vaccinated people that they could resume, their normal activities that they did prior to the pandemic. They can resume certain activities without wearing a mask or staying 6 feet apart, except for where they're required, in their workspace or by the state or the federal law, and including, local businesses like your grocery store. And you also didn't need to travel. I'm sorry, if you were to travel, you did not need to get tested before or after travel or self quarantine afterwards.
Thank you for reiterating that. And yes,
Yes.
I I was shocked. Similar to Brendan there. I think I want to say it was a weekend. No, or was it a
Yeah.
week?
It was like a Friday or something. It was like a Thursday or a Friday.
No, yeah,
Right.
it was like during a week or something.
Right. So
Yeah.
naturally, I log on to like our work emails. Like there has to be an announcement from us. And I was like, yeah, of course it doesn't apply to healthcare centers. And like, as you mentioned before, private entities and people still have, organizations still have the autonomy as far as like what their mask rules are. Just as you can see now, if you go into a restaurant, you are not, you still have to follow by their guidelines, not just by the CDC guidelines. And I think a lot of it was ensuring that we read the fine print. And I don't think the
Right.
fine print was publicized. It was more so, we're done with masks. So I was very like, you know, I was genuinely freaking out. But then I was like, wow, the vaccines work. you know? So it was more so, okay, we really have to get people vaccinated because this is it. This is like people are not gonna wear their masks, anymore. It's the CDC, Dr. Fauci told us, and then the current president is just like the biggest blast. But a lot of folks are not reading that comma if you're fully vaccinated and understanding what that means. So definitely, it was scary. It was scary.
Absolutely. And thanks for sharing that. And we are also joined with our last guest, Paul, and I'll allow him to introduce himself as well.
Hello, my name is Paul. I work as the social media specialist, and my pronouns are he, him, his.
Okay. And Paul, we were just discussing our initial reactions when we first heard the CDC recommendations in regards to wearing a mask. So, Paul, how did you feel about that?
Just like Rama, I was really shocked. I thought it was kind of early, because I don't think it's still been a pretty low amount of people who've been fully vaccinated.
Mm-hmm.
Um, and I also thought, well, in my opinion, I think there will probably be a lot of people who don't wear masks who haven't been fully vaccinated. Like, I thought it might be a little bit dangerous even to be relaxing these guidelines and expecting everybody to, follow this honor system, if you will.
Right. I definitely agree with that. My first reactions were kind of a mix between all of you three. When I first found out, I was just alarmed a little bit and caught off guard. But I do believe in science, especially with me being high risk. I'm like, okay, whatever they suggest, I'm definitely gonna do. Although I still, of course, will wear my mask to protect myself. I was most definitely shocked. I was just like, where is this coming from? Like, we just got to this point. Where's all of this coming from? So I totally can agree with all of you. um, so my next question for you three is, how do you feel about the recommendations now? I know we got your initial reaction at first, but has that reaction changed now? Do you still feel the same way? Because, it's been maybe about 2 weeks now since we got that recommendation. So I guess I'll start with you first, Rama.
Okay. I would say as someone who's been fully vaccinated since the end of January.
Yeah, I was gonna say February, the early February, because we got vaccinated around the same time. Yeah.
First call, I was like, whoa,
Yes.
let me get there. I think and I've been out, I've felt safe, but I've kept my mask on, I've kept my distance, and I
Mm-hmm.
kind of don't see that changing. And that's more so of the numbers of 40% of the population is like, fully vaccinated, and that's not a lot, right?
Right.
So we haven't reached that community herd immunity yet. So therefore, it's still important for me to stay safe. And I will say in DC, most organizations and like most restaurants have kept the mask guidelines. And Muriel Bowser did, the mayor did give that caveat, and so did our governors in both Virginia and Maryland. So that does make me feel better.
Yeah.
Um, and like I haven't seen much of a difference about the mask, but I would say like last weekend, I felt like every single person, according to my social media platform, and then friends included, like were out, right? Whereas I haven't seen this many people in public spaces in about almost 2 years. So the anxiety of that alone, but people have been masked up though. So I'm definitely
Yeah.
hoping that people are understanding, still having those conversations with their immediate networks to assess like what their COVID practices are, and not afraid to have that vaccine conversation, and that we're increasing the vaccine capacity because of this. So people have access to the vaccine, like just a quick Google. Today, you can walk over and see who's doing the vaccine for you. Like at Whitman-Walker, we're providing it to everyone now. So I think that the access has increased, which is a great thing, because getting vaccinated is the safest thing that we can do right now.
Absolutely. Absolutely. Um, and Paul, the same question for you. Have your thoughts changed towards, the recommendations required by the CDC?
Actually, they have kind of. So yesterday was the first time that I really went out. Went out after the guidelines have changed. I started the day at an outdoor restaurant and bar for like an outdoor drag show, and nobody had a mask, and it was weird being out with not having a mask, but because it was outdoors, it was a little bit like okay. And then I was like, do we have to wear a mask when we go inside? And nobody was wearing a
Yeah.
mask. I was like, okay. And then after that, we went to a few different bars in the area around like Logan Circle, DuPont Circle, and nobody had a mask the whole time. Except my one friend who hasn't been vaccinated just yet. But no, everybody I know, everybody in the whole bar didn't have a mask. So it was very weird. It was like being before the pandemic time. And I don't know. I saw somewhere on the news that it said it's so very unlikely that you can get COVID after not wearing or after you get the vaccine. So part of me is like, okay, I'm glad that we don't really need to wear masks in every setting anymore, but it was a little bit strange.
Yeah, I totally agree with that. I've been out since I've been vaccinated, so it kind of has been like a shift for me. At first, I was like, okay, I'm definitely gonna have my mask on the entire time. But now I'm kind of like, okay, I'm gonna wear my mask in, and once I sit down, and I may walk around for a second without my mask if I go outside. But I could totally relate to that. It's a huge adjustment that we're all having to make. So we're all going through this together. And once again, these are all our personal opinions. We aren't like forcing you to believe these. We're just sharing our thoughts with you. Um, and we all are vaccinated for clarity, correct?
Hmm.
Okay. So these
Fully.
recommendations, fully vaccinated. Let me correct myself. Fully vaccinated. So all of the recommendations do apply to us. But do you guys really see yourself going out and not, wearing your mask and really relaxing your mask use, or are you still going to wear your mask everywhere you go, even if other when you're like, of course, in your own personal area, like in your office or in your car, but out in public, anywhere in public, you're going to have a mask on. Paul.
Um, the like health worker in me wants to say that I will always have a mask on, but like I feel like I feel like it's almost kind of like peer pressure in a way. Like I feel like wow, the one person who was wearing a mask yesterday, everybody's like, "Why are you wearing a mask?" It was very like I feel like if I definitely in healthcare settings, like doctor's office, things like that, and on like the metro and a bus, I would definitely wear a mask. But I don't know. I I I don't mind wearing a mask. I feel like it's like such a minor inconvenience. But like after seeing what I saw yesterday and after seeing all these clubs and shows, all of their like events and like circuit parties and all that kind of thing is like fully back in swing. I kind of like don't see masks being utilized, especially in social settings like that.
Right. It's not gonna be that much of a big deal anymore.
Yeah.
Yeah. And we Adrian underscore G400 says, as a teacher, I feel safer with a mask on. Totally agree. As a community health worker, I feel safer with a mask on as well at work. And I'm sure we all can relate to that.
I
Ronald,
agree. Yeah.
what are your thoughts on your mask usage now?
I'm gonna wear a mask. I actually don't see a life anymore without a mask, especially like traveling. I can see I'm okay with being the only person wearing a mask in the space. Any space that I'm in, that's like moving forward. Because I just think to myself that as someone with as a part of a high risk population, it's just protected myself in general from different things. Especially like when winter comes around, when I'm outside, I'm gonna be wearing a mask. And as far as like COVID is still here. Again, if we think about those numbers, people who are fully vaccinated, so we need to definitely keep that in mind. But as far as like the data, the likelihood of you getting COVID when you're fully vaccinated, like that data does support that too. It doesn't
Right.
supports that we are going to be okay as vaccinated folks. And I think the more people get vaccinated, the more comfortable I feel when we go beyond that 40%, right? And
Right.
as far as like sitting at bars, or I do think that like intimate gatherings with friends who I know are fully vaccinated, and we're having these conversations, I am absolutely open to sharing space now, because I did have my quarantine pod, still my pod, but vaccinated pod, right? Because I feel like even but in the workspace for sure we are like a lot of these requirements don't account for like the healthcare setting. It's not in there. It's just like public spaces. And again, like I just feel like a lot of folks are not reading, did not read the fine print. So it's very limited areas, and you have to abide by the organizations or entities that you are affiliated with and that you go into to make sure that you wear those masks. So I think I will wear a mask. That I am because I'm fully vaccinated. I'm still going to continue to talk to people about the vaccine so that more of us are fully vaccinated and that we can really get to a space where we're safe around one another. I'm ready for more community spaces and like more community healing. I'm ready to share space with the community safely.
Yes. Yeah, I kind of feel I don't know. Me personally, I'm always gonna wear a mask for the rest of my life as long as I live for some reason. It's just like my brain has programmed me to think that way. Although, of course, in certain settings, I let up my mask usage. But yeah, I'm definitely gonna wear my mask in certain settings, but a lot of my friends are fully vaccinated. So of course when we go out, we're not wearing our mask around each other because we're like, okay, well, we're we're Moderna gang over here, but Pfizer, Johnson & Johnson, shout out to y'all. I live for it. But I'm definitely still gonna continue to wear my mask. Like you said, we want to encourage everyone to become fully vaccinated just because I don't know in my brain, if everyone were to become fully vaccinated, then I may not wear my mask as much. Although the Marshawn in me will still like want to wear a mask for some
Right.
reason, just because I've trained my brain to think this way. Like I don't know,
And I think
but
it's kept us like a common cold or like other things are
yes,
not like I feel good. I think that the mask
right.
protects me, and I believe in the mask, right? And just like I believe in the vaccine.
We believe in the mask.
And yes, and I think that like it's if anything, with the CDC coming out with this recommendation, it just further proves how accurate and effective the vaccines are. If
Right.
anything, it was definitely abrupt to go from mask every day to like boom, but there are definitely caveats to that recommendation that I really need everyone to pay attention to. That's why conversations like these are so important. Just knowing those numbers. Enough of us, we have not reached that community herd yet. No, immunity. We have not reached that yet.
Right. Mr.JV_access which vaccine we got. I received Moderna. Does everyone want to say it, or can I just say it for everyone? Yes, so we're Team Moderna on the line today. And actually, before the live, I was thinking about this. I was like, this is the first space where everyone has had the same vaccine, because there's always a Pfizer everywhere you go. Like, oh my God, this is the first Moderna group chat I'm in.
I mean, mm-hmm.
Yes, but did you guys have anything else to say? And if anyone has any questions, feel free to ask us in the comments, or you can write us personally on Instagram.
Yeah, just get educated. You can learn more with us at Whitman-Walker. You can directly ask me questions, about next steps as to where to get the vaccine, and conversations about, fear, completely normal, and the mistrust. We can talk through those things, and wherever you need support in. And just remember, again, getting this is more so a community effort. This is not something that we can do alone as far as ending COVID-19 or, reducing its risk. We are still losing people to COVID-19, and it still predominantly affects our Black and Brown communities. So just keep that in mind and talk to your cohorts and be vigilant, be aware, and protect yourselves in your community, whether it's keeping that mask on, and or getting fully vaccinated, or getting some education around it as to where we are and what's going on.
Yes. Adrian_G400 wrote, IDK, while we weren't pushing the use of masks for flu/common cold like 20 plus years ago, instead of teaching how to cough in our elbow, we could have worn masks and avoided a lot of unnecessary sicknesses. Now, this is a completely different Instagram live, because we could talk about this forever, because people still can't cough in their elbows. At least a mask would have been an easier way for all of us to be protected, because I literally catch the flu every year, and this is the first year I have not caught the flu in maybe like 7 years. Every year in February, I get the flu, and I did not get it this year.
Right. And Adrian, hi, Adrian. Absolutely. That's definitely a different conversation and a lie.
Yes.
Masks work. So that's why I'm keeping mine.
Absolutely. Well, I want to thank you guys for joining me today, Paul, Rama, and Brendan, and sharing your thoughts with us. All of us on the phone, we believe in science, although we want you guys to know that it's normal to be caught off guard, kind of how we caught off guard with COVID-19 and the new CDC restrictions. But we definitely follow all of the recommendations that the CDC recommends, and we also suggest you getting your vaccine, because that's the safest preventive measure from contracting COVID-19. Before I sign off, I want to remind everyone that knowing your status is one of the best ways to stop the spread of HIV. Whitman-Walker Health can help you figure out your HIV status through our free HIV and STI testing services by appointment only at the Liz, which is located in Northwest DC, and our Max Robinson Center located in Southeast DC. And you can make an appointment by calling oh my God, the pinned comment. Where did it go? Well, you can DM us or go through our Instagram and see the flyer. But the number is 202-797-4439 for HIV STI testing. And you can also access our PrEP services by calling 202-939-7690. And also our PEP services by 202-797-4439. If you're newly diagnosed with HIV or need re-engagement into care, you can also call 202-797-4439. And also, my last point I'm going to make today are just a few recommendations for fully vaccinated folks. We also follow these recommendations, but for people who aren't vaccinated, these are the safest ways to protect yourself. And they include staying at least 6 feet away from people when in public, wearing a mask in public, avoiding places with large crowds, encouraging work from home if possible, speaking with loved ones over the phone, over FaceTime, Duo instead of in person, socially distancing yourself for the care of your community, and also staying up to date on state, local, and national guidelines for getting tested, quarantine use, and general safety. Also, my favorite recommendation, washing your hands for at least 20 seconds with soap and water. And also staying at home if you don't feel well. So, exactly, Birdman hands for 20 seconds. You can follow us on Twitter, Facebook, and Instagram at Whitman-Walker and at Real Talk DC underscore to stay up to date with all things Whitman-Walker Health. Thanks everyone for joining us, and once again, thank you, Brendan, Rama, and Paul.
Thank you, Marshawn.
Thank
You're
you.
welcome. Bye, you guys.
Bye.